Is there any shortcut to weight loss?
So, over the last many years, we have seen multiple cases of obesity. But last year in 2025, obesity has been recognized as a disease in itself. The science is expanding so much, there's so much to learn and realize that we have so many options even for obesity and weight loss.
So, ma'am, what is a commonly used medicine in weight loss?
So, usually these weight loss medications, whether you take as a tablet form, but I think the real weight loss we will start seeing within 3-4 weeks of.
ఒక పర్సన్ 5 to 10 kgs తగ్గాలి అనుకుంటున్నాడు అంటే కెన్ హీ యూజ్ దిస్?
As through this channel, what I want to pass on the main information is it is, but not to like prepare for a wedding, prepare for an engagement. We are actually seeing just for that short period of time they are doing it. That should not be done.
So here we are with Aarathi ma'am, and we have everyone has a doubt like weight loss and weight loss drug. So let us know few words from Aarathi ma'am how dangerous this weight loss drug is. So hi ma'am, thank you for your valuable time here, and you here to share few information like basic information so that we can know how safe we can be. So coming to weight loss, before we would like to know few words what exactly Aarathi ma'am is.
Thank you for having me here. I'm a general physician. I've been, now this is the 20th year of my practice as a general medicine consultant. So over the last many years, we have seen multiple cases of obesity. But last year in 2025, obesity has been recognized as a disease in itself. ఇప్పటిదాకా overweight ఉండటం, obesity ఉండటం, we thought it's part of the person, how he is.
It's part of a life.
Yeah, but now it is a disease. So now with newly introduced weight loss drugs and everything, I think the science is expanding so much. There's so much to learn and so much to realize that we have so many options even for obesity and weight loss. So today I think we will discuss on that. Yeah.
That's gonna be very interesting for sure. And before that, everyone do subscribe so that you can know more knowledge about more things. And ma'am, exactly what exactly this weight loss drug is?
So ఇప్పుడు obesity అనేది మనం actually how do we measure our obesity levels, or this person is underweight, this person is overweight, this person is obese అనడానికి we do the height and weight measurements అన్నమాట. Height and weight తోటి BMI అనేది చెక్ చేస్తాం. Anything above BMI of 25 is considered to be overweight, about 27 is obesity. Okay, ఈ obesity అనేది they develop multiple health issues. ఎప్పుడైతే పర్సన్స్ BMI ఎక్కువ ఉంటుంది, వాళ్ళ వెయిట్ వాళ్ళకి ఐడియల్ వెయిట్ కంటే ఎక్కువ ఉన్నారు అంటే that will lead to multiple health conditions. So these patients can develop heart diseases, they can develop osteoarthritis of the knee, they can develop cardiac issues, they can develop diabetes, hypertension. Younger people అంటే ఇప్పుడు చిన్నపిల్లల్లో కూడా we see lot of overweight kids, and we see that they attain puberty earlier, then we see that they have developed multiple health conditions like PCOS, polycystic ovarian disease, ఇవన్నీ obesity related. So basically it's a lifestyle disorder. మనకి లైఫ్ స్టైల్ బాగుండకపోవటం వల్ల ఓవర్వెయిట్ అవ్వచ్చు, దాంతో ఇట్ కెన్ కాజ్ మల్టిపుల్ డిజీజెస్. సో దిస్ ఇస్ వాట్ ఈస్ ఒబేసిటీ రిలేటెడ్ డిజీజెస్ దట్ కెన్ హ్యాపెన్ బికాస్ ఆఫ్ ఒబేసిటీ.
ఇప్పట్లో చూసుకుంటే ఈ వెయిట్ లాస్ ఇంజెక్షన్స్ చాలా పాపులర్ అయిపోయినాయి, ఎందుకంటారు?
ఇప్పుడు వెయిట్ లాస్ డ్రగ్స్ అనేది ఇట్ హ్యాస్ బీన్ దేర్ ఫర్ అ వైల్. అంటే చాలా ఏళ్ల నుంచి ఆల్మోస్ట్ ఫ్రమ్ లాస్ట్ 20 years వీఆర్ సీయింగ్ వెయిట్ లాస్ డ్రగ్స్, బట్ దే యూస్ టు కాజ్ ఒక మోడెస్ట్ వెయిట్ లాస్, సే 5 to 10% ఆఫ్ బాడీ వెయిట్ loss. But in the last 6-7 years, say from 2020 to 21 నుంచి వచ్చిన స్టడీస్లో we have seen that the newer medications which are in the form of tablets and also injectables, they are causing up to 15 to 20% of weight loss, which is very significant. 15 to 20%, a normal person to achieve that kind of weight loss has to work really hard, whereas 15 to 20% through the weight loss medications anedi it has become really it's looking like a life saving thing, because you're going to go with a
shortcut.
lot of shortcut for some people at least. 15 to 20% is a big number, and easily injectable forms are available ఉన్నాయి. So you can take it once a week injections, which is much easier to administer rather than taking the daily tablets. That's why this weight loss injections have become a big fad, and it has become very popular because of the ease of injection తీసుకోవటం. Second thing is also it is weekly injections, right? Yeah.
So how long it takes to a body to react?
So usually these weight loss medications, whether you take as a tablet form or an injectable form, will take anywhere near, we'll have to take it at least for all these medications have been studied for 56 weeks to 72 weeks, until we are talking about somewhere between 1 year, 1.5 year. But I think the real weight loss we will start seeing within 3-4 weeks of injections itself. We do see some amount of weight loss, and that does impact. So but then we have to keep continuing it to see a sustained weight loss. మనము చాలా రోజులు తీసుకోవాల్సి వస్తుంది, అట్లీస్ట్ 2 to 3 months or up to 6 months minimum that has to be continued. Yeah.
సో ఎఫెక్ట్ కనిపించాలంటే 6 months మినిమం మనం కంటిన్యూస్గా తీసుకోవాల్సి వస్తుంది. ఇఫ్ ఎట్ ఆల్ బ్రేక్ చేసి తీసుకుంటే దాని ఎఫెక్ట్ మళ్ళీ స్టార్టింగ్ నుంచి చేయాల్సి వస్తుందా?
Yeah, so there can be a rebound weight gain. So what happens is these weight loss medications valla you will there's a change in your appetite. Basically brain ki signal వెళ్తోంది that ఇప్పుడు ఆకలి నీకు లేదు, don't eat now. So it is slowing down your metabolism. తిన్న ఫుడ్ గ్యాస్ట్రిక్ ఎంప్టీయింగ్, అంటే ఇట్ ఈస్ టేకింగ్ అ లాంగర్ టైమ్ టు డైజెస్ట్. ఓకే, సో బేసిక్లీ యూఆర్ నాట్ ఫీలింగ్ హంగ్రీ, దేర్ బై యూఆర్ నాట్ ఈటింగ్. So but if you stop the medication, the effect of this injection is going to go away. So you're going to have normal hunger. Then you are going to have a rebound weight gain.
సో మెడిసిన్ ఈస్ సెండింగ్ ఎ సిగ్నల్ లైక్ నువ్వు ఆకలి అయ్యట్లేదు, నువ్వు ఫుల్ ఉన్నావు అని మెడిసిన్ పంపిస్తుంది సిగ్నల్.
Correct.
Is that
so
true?
that is true. That is true. So this is a molecule called GLP-1 analog.
ఓకే.
సో ఇది మనకి నార్మల్గా బాడీలో ఉండే హార్మోనే.
ఓకే.
అందరిలో ఉంటుంది, మీలో ఉంటుంది, మాలో ఉంటుంది. ఎవ్రీబడి హ్యాస్ దిస్ హార్మోన్. But the effect of this hormone in our bodies are just for 1 to 2 minutes. It gets degenerated by an enzyme. So now what injection form lo, medication form lo, we are replicating this particular hormone, which is going to act at a multiple level. One, it is acting at your stomach level, saying that you are full.
You're full.
Thereby it's sending a signal to the brain saying that you're full. Okay. It is going to keep your food for a longer time, so you're going to feel full for a longer time. So that's how it is acting. So normal ga body lo jarigedi, because it's taking lesser time, like it has a small thing, we are giving it as an outside, as this hormone రూపంలో ఇస్తాం అన్నమాట.
ఈవెన్ మెడిసిన్ ఇస్ ఫిల్లింగ్ అవర్ టమ్మీ టు.
Yeah.
సో మ్యామ్, వాట్ ఈస్ అ కామన్లీ యూజ్డ్ మెడిసిన్ ఇన్ వెయిట్ లాస్?
So there are two group of medications. There are multiple group of medications, but right now what is popular and what is doing the rounds is semaglutide and tirzepatide. Semaglutide వచ్చేసి injectable form, what you have heard from all the celebrities. They've been taking Ozempic, the shots of Ozempic, Wegovy, idanta semaglutide, which is also available as a tablet form, also available as an injectable form. Whereas coming to Mounjaro, it is tirzepatide. అది injectable form, once a week injectable form లో తీసుకోవాల్సి వస్తుంది. So now good news is that also this has gone off patent last month, maybe 1 month back. So we are going to see lot of Indian products also, Indian companies also taking up these products. E molecules off patent వెళ్ళిపోయి కాబట్టి it's going to become cheaper and easily available in the market right
So
now.
what is the difference between injection and a tablet?
Yeah, tablet has to be taken as a daily form.
Okay.
రోజు తీసుకోవాల్సి వస్తుంది. We started at a 3 mg dose, we increased to 7 mg up to 14 mg. అది రోజు తీసుకోవాల్సి వస్తుంది. Whereas injectable forms are once a week format usually.
Once a week format.
Okay,
if at all ఒక person 5 to 10 kgs తగ్గాలి అనుకుంటున్నాడు అంటే can he use this?
So that is what it has come to. So as through this channel, what I want to pass on, the main information is it is not for cosmetic reasons. ఊరికే నేను ఓవర్ వెయిట్ ఉన్నాను, ఒక 5 kilos తగ్గేస్తాను, 10 kilos తగ్గేస్తాను, ఒక షార్ట్ కట్ లాగా వాడొద్దు. దిస్ ఇస్ నాట్ ఫర్ కాస్మెటిక్. సి ఇట్స్ అన్ ఎక్సలెంట్ సైంటిఫిక్ మాలిక్యూల్. అంటే చాలా మందికి హూ ఆర్ రియలీ స్ట్రగ్లింగ్ విత్ వెయిట్ లాస్, ఇట్ విల్ మేక్ అన్ ఇంపాక్ట్, ఎస్పెషలీ హెల్త్ కండిషన్స్ ఉన్నప్పుడు. సో ఊరికే ఎవరికి వాళ్ళు ఓవర్ ద కౌంటర్ ఎట్లయితే డోలో వాడతామో అలాగా వాడకూడదు. Okay, it will have its side effects. We don't know the long-term effects of these medications. So best is to go with your physician. Talk to them. Talk to your doctor. See if you fit into that category. అంటే మీకు అసలు ఇండికేషన్ ఉందా లేదా. ఎప్పుడైతే మీ BMI above 30 ఉంది, yes, they can. It is approved for clinical indication ఉంది. And second thing is, if BMI is above 27 and you also have, say, severe osteoarthritis, you have some cardiac issues, underlying diabetes undi, ilanti vallaku kuda it is indicated, clinically it is indicated. Even it is indicated in obese children above 12 to 15 years kuda we can start them if they are obese with health conditions. But not to like prepare for a wedding, prepare for an engagement. We are actually seeing use of people taking injections just because they are going to get married, or just because just for that short period of time they are doing it. That should not be done. ఇది మెడికల్ సూపర్విజన్లోనే చేయాలి.
ఓకే, అండ్ వన్ రియాలిటీ పీపుల్ షుడ్ నో అబౌట్ దిస్ థింగ్ అంటే,
వన్ రియాలిటీ అంటే దేర్ కెన్ బి అ రీబౌండ్ వెయిట్ గెయిన్. తీసుకుంటారు, తగ్గుతారు, కానీ మనం అండర్లయింగ్ లైఫ్ స్టైల్ని ఫిక్స్ చేయలేదు అంటే, ఇఫ్ యూఆర్ నాట్ fixing your diet, you're not fixing your exercise, if you're not going to fix it, you're going to regain all that weight. Rebound weight gain avutundi. And one more thing is, when there is loss happening, it is not just the fat loss, no, you're also going to lose your muscle mass. No, sarigga daniki taggatuga manchi protein diet, if you're not giving good protein content, if you're not making your diet nutrient rich, if it's not there, you're just going to stop eating and lose weight. So that muscle mass also is going to be lost. So this is nutrient deficiencies ravachu. So that needs to be looked into.
And ma'am, a common side effects for this?
Yeah, so the common side effect, or you can call that is the effect of the drug, is it does cause severe gastritis. Because we are stopping the gastric emptying, we are reducing the gastric emptying, so it is going to cause lot of nausea, discomfort, unable to eat. Some people may develop diarrhea, abdominal discomfort. So a lot of gastric symptoms is what we see. These are common side effects that we see.
And few people with fear in their hearts, they take this medicine daily. అంటే నేను ఇది ఆపేస్తే మళ్ళీ వెయిట్ ఎక్కడ గెయిన్ అయిపోతాను, లైఫ్ లాంగ్ తీసుకుంటూ ఉంటారు. ఈజ్ దట్ రియలీ సేఫ్?
No, right now people are not doing that, I feel like. So ఇప్పుడు మెడిసిన్, ఓరల్గా మెడిసిన్ స్టార్ట్ చేయడానికి కూడా ఇట్స్ ఇస్ ప్రిస్క్రిప్షన్ బేస్డ్. సో ఓన్లీ ఇఫ్ యూ నీడ్ ఇట్. అండ్ ఇప్పుడు వన్ ఆఫ్ ద డిజీజెస్ ఐ వాంటెడ్ టు హైలైట్ ఇస్ obstructive sleep apnea. వెయిట్ పెరగటం వల్ల స్లీప్ ఇస్ గెటింగ్ డిస్టర్బ్డ్, అండ్ పేషెంట్ గోస్ ఆన్ టు డెవలప్ OSA అనే కాంపోనెంట్. సో ఇన్ దీస్ పేషెంట్స్ వెయిట్ లాస్ ఇస్ ది ఓన్లీ వే. And they are not able to lose weight because of whatever they already have reached a point where they're not able. In those kind of patients, maybe they may need it for longer time and medications.
And for our audience sake, మా ఆడియన్స్ నుంచి అడుగుతున్నాను, నా గురించి కాదండి ఈ క్వశ్చన్. ఈజ్ దర్ ఎనీ షార్ట్ కట్ టు వెయిట్ లాస్?
No, this is not exactly a shortcut. So this is only clinically indicated patients lo maatrame we should give, not as a shortcut. Don't use it as a shortcut. It's a good medication. And if you are clinically indicated, you have health conditions, definitely. But yeah, the shortcut is the long cut that you have to do. Your underlying health issues has to be, lifestyle has to be fixed.
And what exactly international guidelines are saying about this weight loss?
Yeah, weight loss medications is a big step in management of diabetes, heart diseases, people who have underlying risk. It is a big step. So obesity has been recognized as a disease now. It is not just a health condition or lack of willpower. It's not that. You're not overweight just because. It is recognized as a disease. And these medications are like a big step, because we are talking about 15 to 20% weight loss. So in a patient who has underlying health conditions, it's a big step forward. Kakapote, it is going to be like a chronic disease, like how we are giving medications for diabetes, hypertension, where they continue to take medications. Most likely this will also come into that chronic disease category, where you continue to take these injections or tablets lifelong, probably. Yeah.
And a crucial question, ma'am. If at all a pregnant lady, after her carrying, delivery అయిపోయిన తర్వాత they'll start putting on weight అనేది వచ్చేస్తుంది, and they'll start using this. Is it really safe for a woman after a birth?
No, right now pregnant women and breastfeeding women, we don't have enough data, so it is not for them.
It's not for them.
Yes.
So strictly వెయిటెడ్ ఉమెన్, లైక్ ప్రెగ్నెంట్ ఉమెన్స్కి తర్వాత డెలివరీ అయిన తర్వాత ఈ వెయిట్ లాస్ ట్రీట్మెంట్ అనేది జరగదు, తీసుకోకండి, ఇది మంచిది కూడా కాదు అని చెప్పారు. థ్యాంక్ యూ వెరీ మచ్ మ్యామ్ ఫర్ యువర్ వాల్యుబుల్ టైం, వచ్చి మాకు ఒక వాల్యుబుల్ ఇన్ఫర్మేషన్ ఇచ్చారు యాక్చువల్లీ. అండ్ మెనీ బిలీవ్స్ దట్ దేర్ ఇస్ ఎ షార్ట్ కట్ టు దిస్ వెయిట్ లాస్ థింగ్, అది మంచిది కాదు అని కూడా చెప్పారు, విచ్ ఇస్ ఎ రియలీ గుడ్ థింగ్. అండ్ ఈ వీడియోతో నేర్చుకోండి, తెలుసుకోండి. ఇంకేమైనా డౌట్స్ ఉంటే కిమ్స్ హాస్పిటల్లో ఆర్తి మ్యామ్ని కలవండి. థ్యాంక్ యూ మ్యామ్, థ్యాంక్ యూ. దట్ వాస్ ఎ వెరీ వండర్ఫుల్ టాక్ విత్ యూ.